back. Well, our next guest was plagued by sinus congestion, difficulty breathing, and headaches all her life until she did one thing. Candee Gardner went to visit Dr. Madan Kandula at the Advent Sinus Center. Welcome to the Morning Blend, both of you.
Thank you.
Thanks for being here. You know, we've talked so many times about how sinus problems can really affect the quality of your life, and I think that's something you hear probably every day from a lot of your patients.
Absolutely. Yeah, and it's varied. So some folks have breathing issues, some folks have sinus infection issues. One of the big categories that we deal with and help folks with are headache issues, and a lot of folks don't really feel like they know that that's an option, know that we can do some things about it, and we can. I mean, and that tends to be, for the folks that we can help on that front, can be life-altering, life-changing. It's pretty dramatic.
How do you know if a headache that you're having is caused by your sinuses? Is it a distinct difference?
It's not. I mean, so that's the tricky part. So certainly folks can have headaches that have nothing to do with their sinuses. Some folks have issues that are just sinus-related by itself. And then a lot of folks have this mixed bag where they have sinus issues and tightness in the sinus openings that can lead them into more of other kinds of headaches, like migraine headaches. And that's where it gets really tricky. For medical professionals like me, a lot of folks sort of say, hey, it's too tricky. I don't want to be dealing with this. I don't want to stick my foot out there and try to make a change, because you might get burned. It's possible you get burned where you try to do some good, and if you're on the wrong tangent, if you think you've got one thing and you actually have another, you may not actually help the cause.
Yeah, and that's something that I know you're so good at, is determining what the actual problem is. Candee, for you, you suffered from sinus headaches your whole life?
My whole life.
And
yes.
what changed you from saying, I just have to deal with this? Did something happen to you a few years ago?
Yes, I fell in a parking lot.
And you hit your
concrete.
face?
I landed on my face.
And what did that do? How did that change things?
The headaches got so much worse that I could not go about my daily life. And I had to do something.
And you said that your husband told you about Dr. Kandula.
Yes, yes, my husband, Steve.
And so you suffered with these headaches your whole life.
Yes.
You went in to see Dr. Kandula. What happened from there? What did you do?
He went through tests with me, and he left it up to me as to how far I wanted to go with the surgeries, if at all, and I determined I wanted to do the whole thing.
Yeah.
I'd had enough.
And the whole thing took you how long?
The surgery was 45 minutes.
That's like nothing.
And a week after the surgery, I started feeling so much better.
In 1 week?
In 1 week.
That's
The
amazing.
headaches all but disappeared.
I bet you wish you had done it a long time ago.
A long time ago, yes, yes.
How has the quality of your life, because that's something Dr. Kandula talks about a lot, is just that, you think you have to suffer so many times because it's just your anatomy or the way you were born, or you've always dealt with it. Is that kind of how you had felt?
I did. I had nothing to compare it to. I thought that that's just the way.
And knowing now, what you know now, what would you say to people who are living, in a situation that you were?
Go to Dr. Kandula.
Do something about it.
He's changed my life. He's changed my life so much for the better.
Oh.
Yes, yes, I can breathe. It's so wonderful.
And the headache's gone?
Gone.
That's
Gone.
amazing.
I keep waiting for one to crop up, and it never does.
Oh, I love that. I bet that makes you feel really good
Absolutely.
to hear that.
That's great. That's why I do what I do.
How did you know exactly what to do with Candee and what her problem was?
Well, part of it's just taking a step back, listening to the story, and then in her case, she had an in-office CAT scan, which we've talked about before. Without that information, I don't know what's going on. And on her CAT scan, it showed blockage in the breathing passages, blockage on the sinus front, and really matching up her symptoms with what we were seeing, and then talking through the various options. It's not a one size fits all, and as she said, we kind of really talk it through from, one option is doing nothing. We can do nothing. We can just sort of deal with this. It's not going to do you in. Then up the ladders, we talk through some of the in-office options versus a surgery option, and for Candace, it was just a matter of, like she said, that was what she wanted to do, was to take it to the whole, do the whole deal, straighten the septum out, shrink the humidifiers down, get the sinus openings open, and really try to sort of put an end to it, and it's great. It did the trick, which is what we're looking for. On the front end, though, we certainly talk through, there are times where we think we're dealing with one thing, we go and come after it, and sometimes, it just doesn't get to where we want it to be, and so that's a possibility as well. So somebody needs to know that on the front end, and somebody needs to make an informed decision. My goal in life is to really offer folks their options. That's not my decision to make, it's their decision to make. I think a lot of folks in my field sort of feel that, boy, I don't, like I said, I don't want to go there, I don't want to stick my foot out, I'm just not even going to talk about these options, and I think that's wrong.
Well, to know what you can do to live a more quality life, what's your favorite thing to smell now? Do you have a favorite scent?
Oh, Italian food. I can smell chocolate. I can smell chocolate.
I love that. I think that's wonderful. I want to make sure that I give everybody the information so they can contact Dr. Kandula as well. If you want to smell Italian food and chocolate, maybe for the first time, you need to call. Here's the information for the Sinus Center at Advent, Advanced Ear, Nose, and Throat Specialists. They're on North Mayfair Road in Wauwatosa, 414-771-6780 or advent.md. Thanks so much, Candee, for being here, and thanks, Dr. Kandula.
Thank you. Thank you very much.